Welcome to the OASIS Electronic Medical Record Training. This online training will allow you to understand and use the OASIS Electronic Medical Record. To access the OASIS Electronic Medical Record, open a session by identifying yourself. This access mode provides clinical data's confidentiality, security, and allows customization of clinical information according to your profile. Please note that all your accesses can be audited in order to ensure confidentiality. Once open, the OASIS navigation principles of OASIS Electronic Medical Record are similar to those found in Windows applications and the Internet. Therefore, when you select a menu item or link, you are directed to the intended section, or you are offered an option. The main screen is divided into three parts. The first section gives access to menus, toolbars, and displays patient lists being used. The second section regroups patients' information, which includes location, reason of admission, and treating physician. By double-clicking on patient's name, you can obtain full demographic information. The last section presents services columns, which allows you to follow up on clinical data. Presented as an indicator of time, the display shows the arrival or modified patient data. Red indicates an abnormal result, while bold indicates an information that you have not yet consulted. For example, the digital indicator, which indicates 1 minute in red and relates to the patient's Sophia post, means that within the laboratory results of this patient, there is at least one abnormal result which has not been seen by the user. In addition, Ms. Post's latest laboratory result has been available for 1 minute. Results in red are therefore those to consult urgently. It is important to note that the bold and the red indicators are specific to each user. They do not indicate whether other users have accessed or not the results. Let us now examine the header menus. To display the options in the different menus available, click once on the desired item. For example, when you click on Patient List, you have access to a series of features related to this theme. Please note that some menu options will be available as per the development of the OASIS Electronic Medical Record. Let's examine the toolbar. The toolbar located beneath the menu is very useful for quick navigation within the OASIS Electronic Medical Record. To learn the function of each button on the toolbar, go over them slowly with your cursor. Please note that when a button is not available, it shows up in gray, as is the case here for the buttons Forward and Current Patient List. The patient list presents an overview of patient information. On the left, the columns contain patient information. To the right, other columns lodge the information in connection with the clinical data grouped into categories corresponding to ancillary systems such as laboratories, medical imaging, etc. The section providing information relating to patient presents summarized information. You can sort the contents of each column by clicking on the header. A new click on the header of the column can move from an ascending to descending sort. This sorting function is available only when the title of the column is in bold. For example, if you wish to view the file of a specific patient, you can sort by name to display the patient list in alphabetical order, which will facilitate your search. For additional information about the patient, you can access the demographic window by double-clicking the patient's name. You will have access to certain details concerning the notice, the patient's details, or even the different medical record numbers. Information relative to times, such as minutes, hours, weeks, months, and years, displayed in the right columns represents the elapsed time since new clinical data has been available. For example, the highlighted patient has new laboratory results available since 2 hours, a report of medical imaging since 5 days, and so on. It is important to note that the modification of clinical data will also reset the clock. Therefore, if a request from the medical imaging service passes from the status of preliminary report to the status of final report, that information is transmitted to the OASIS Electronic Medical Record and the clock resets. The medical imaging clock dating 5 days now indicates 1 minute since the status has just been modified. Note that new information is sent to your screen whenever you change pages or when you refresh the page using the button on the toolbar. It is, however, important to note that for the medical imaging service, the clock is initialized from the time the OASIS electronic medical record receives a preliminary report. By double-clicking on a time value in a column on the right section, the list of clinical data appears. In this case, by double-clicking on the 1-hour laboratory column of Ms. Post, we obtain the list of laboratory results. This is then a second level of information specific to a patient for one type of service. Results lists are displayed in a standard format. They have common functionalities consisting of a header list and a section of content in which information is transcribed. It is possible to distinguish the new results you have not consulted. They appear in bold in contrast to other results that are viewed in normal font. The bold disappears from the list after you exit the screen or after you have updated with the refresh button in the toolbar. As for the clock, it will reset when new results are received in the OASIS electronic medical record. Also note that any abnormal results will also be displayed in red and bold. After leaving the screen or having updated, these results will remain in red, but in italics, to indicate that you have seen the results. Once you have learned to operate the results list, you will be able to use any other list in the OASIS electronic medical record in the same manner. Let's see how to select and save a list of appointments. The OASIS electronic medical record enables us to select a list of patients having an appointment to the clinic for a given date. Physicians will have direct access to their lists of appointments in outpatient clinics from the tab Users List. According to the physician, there will be none, one, or more lists according to the external consultations he performs. If you are not a doctor or if appointment list you need is not available via the user list, you must select a list from the system called Scheduled. The selection parameters allow you to choose a clinic or, more accurately, the name of the physician or professional associated with the clinic. The search for lists can be time-consuming due to the number of clinics listed. It is therefore recommended to seek your clinic and to save it in your personal lists in order to avoid repetitive searches. To do so, you will still need the name and location of your clinic. After selecting your clinic, you have to save it. By default, your list will be dynamic. Whenever you use this list, it will give you the patient list of that current day. If you want to keep a portrait of an appointment list for a specific day, you must change the setting to static. The OASIS electronic medical record makes available the function Patient Summary. From the patient list, it is possible to consult it from the menu, Summary. You can also access it quickly by selecting the patient with the right button of your cursor. The patient summary enables viewing information on the same screen, such as laboratory microbiology results, medical imaging, and pharmaceutical profile. The information presented is equivalent to the data lists. By clicking on a line, you have direct access to the detail screen. For services such as laboratory, microbiology, and medical imaging, Information Summary presents the results obtained during the last 72 hours or the 10 most recent results. For pharmacy service, all active drugs. User Preferences. The default values of the OASIS electronic medical record are criteria to determine its basic component. You can change the display settings through the user menu, User Preference. Once you've made your selection, OASIS electronic medical record will open during successive launches according to the preferences chosen regardless of the default settings. The tab Lists allows you to modify the display lists. You can define the maximum number of rows you want to see. The tab Miss allows you to change the language preference of the OASIS electronic medical record and retain the chosen option at the time of logout. For details on user preferences, you can consult the online user guide of the OASIS electronic medical record by clicking on the question mark on the toolbar or by visiting the Help menu.